Thank you for taking the time out of your afternoon to come in and learn something, hopefully, about Medicare. I've been in this industry for 15 years, specifically helping consumers, the older adult population, with their Medicare needs for the last 10. Retirement planning, life insurance, etc. I'm not here representing a specific carrier. I'm a fiduciary in the industry. I offer every carrier in 46 states. So I pretty much have a decent pulse on what's occurring around the nation. You have siblings, friends, what have you, in Illinois or Indiana, etc. I would certainly be able to help them and would love and appreciate the referral of helping those consumers as well. This is confusing and it changes every year. Senior Enrollment Solutions, we are nationwide. We're in 46 states. The closest office to us is at Clintonville and Walton Boulevard, right? It's like 3.5 miles down the road. We took over that building about 2.5 years ago. We have another office out in Macomb, which is the next closest office to this location, obviously being in Waterford. Here we are, right? Ellie does work out of the Waterford office. I am there some days. Other days I'm out of the Macomb office. I kind of bounce around a little bit, doing trainings, doing educational events, and then helping our agents be able to really understand coverage for you as well. That the last thing any of us want is to be sold something. Whether or not it's Blue Cross or HAP, Humana, whomever, it's not okay. And so really helping those agents understand each specific carrier and which counties, which carriers operate best in this area is incredibly important. So that way you're never pigeonholed into a specific plan or carrier. Make sense? So once again, my name's John Fallett with Senior Enrollment Solutions. Today we're going to be discussing your Medicare basics. As I mentioned, I'm going to try and keep you guys at 1,000 feet or higher. We're not going to go into plans, premiums, prices. I'll touch on that briefly if any of you have like some basic questions. Obviously, there's some websites we can go to. However, as you're understanding your Medicare, the first thing that we have to understand is we need to gather our information directly from Medicare, right? They have a wonderful website. There's tremendous amount of publications. You're more than welcome to stop in our office. I would be happy to email you anything you need, but gather it from the source, not from a for-profit or nonprofit company that's trying to persuade you into a plan. Does that make sense? Okay, so what is Medicare? Medicare is the federal health insurance program offered to 4 different groups of individuals. First, those that are age 65 and over can obtain Medicare. We'll go into how you obtain it in a moment. Certain people younger than 65 with disabilities. Individuals with ALS, Lou Gehrig's disease, and individuals that have end-stage renal kidney disease or permanent kidney failure. Medicare has specific plans for those individuals. So let's discuss what your Medicare consists of. There's 4 parts to your Medicare and only 4. A, B, C, D. Learn your ABCD. Everything else is simple. It'll lie down. You'll be able to understand exactly what your costs are, your co-payments, your out-of-pocket, your risk, etc. So let's start off with your Part A. Individuals who have worked 10 years as a U.S. citizen who's paid enough into FICA tax automatically receive Part A insurance. It comes automatically from the federal government. So what does your Part A consist of? Well, your Part A is really the rental of a semi-private inpatient hospital room. It's providing you the room itself. Anything else that occurs is not under Part A. You're just renting the room at a $1,364 per occurrence deductible. With your original Medicare Part A, what our government is providing to you after paying all those taxes into FICA is they're providing you hospitalization coverage with a $1,364 deductible, and when and if you satisfy that deductible, you're responsible for 20% of any and all remaining charges until Kingdom comes. There's no stop loss to your original Medicare. So for instance, you break a hip, you're admitted, you pay the $1,364 and 20% of any and all remaining charges. 2 weeks later, you go back in because you caught pneumonia. Everyone catches pneumonia who breaks a hip. Thanks to the hospital. Thanks to whomever, it just is what it is. So at that point in time, you're going to be responsible for yet another deductible, separate occurrence, and then 20% for that pneumonia charged thereafter. Does everyone grasp your Part A of Medicare? Does this make sense? You can pay for it multiple times if you have a stroke, a heart attack, pneumonia, a broken hip, et cetera, et cetera, et cetera, et cetera.
Lord, take me out all at once.
All at once. This is what our broke government is providing as their Part A of Medicare, right? So I'm just the messenger. I did not create this, right? So don't beat me up, but understand what you're receiving. Do we all grasp the Part A of Medicare? Per occurrence. Per occurrence. For your lifetime, yes. And then that 20%, once again, does not ever stop. You are paying that out, room and board only, okay? We'll get to everything else in a second. This is just to allow you to go into St. Joe's, Beaumont, Crittenton, Huron Valley. I'll name them all, right? I'm not biased on hospitals, but for you to be admitted into the hospital, you should be well aware that you're paying this $13.64 and another 20% thereafter. Does that make sense? Okay. Your Part A, what does it consist of? It consists of your inpatient hospital room, as I mentioned, home health care, a skilled nursing facility, and God forbid, hospice care. Most consumers, once again, if you've worked 40 quarters as a U.S. citizen, there's no cost to have your Part A. Other consumers that may have relocated to the United States and never worked here, what have you, there is a fee. But for most of us, there is no cost to have your Part A of Medicare. So let's talk about your Part B now. If you opt to have Part B coverage, which most consumers choose to do, your Part B is going to cover everything while you're in the hospital. Your durable medical equipment, your IV pole, the rental of the bed, any medications you may take while hospitalized, your surgeon, anesthesiologist, assistant surgeon and anesthesiologist, that's all covered under your Part B of Medicare. So your Part B of Medicare, for most consumers, has a premium. It's $135.50 a month that most consumers are paying out to obtain or to have the Part B. With your Part B, anything out of the hospital, any therapies, physical, speech, occupational, any outpatient testings, outpatient surgeries, all covered under Part B. So the easiest thing really to understand is what Part B does not cover. Part B doesn't cover your dental, the majority of your vision, your hearing, and your prescription drugs. So anything medically necessary outside of that hospital rental room is going to fall on the Part B at a premium of $135.50. Your Part B has an annual deductible, not a per occurrence, a once a year deductible, and it's currently $185. Basically, what Medicare is asking of you is you pay the first 2 doctor's visits, maybe 3, out of pocket, and then after that, they'll cover you at 80%, leaving you once again with that 20% remaining balance until Kingdom comes. There's no stop loss to your original Medicare. Does this make sense so far? Okay. So your Part B, medical and other services while in the hospital, your outpatient hospital services and your home health services covered under Part B. So we understand now that there's a whole lot of lacking coverage within your Medicare. So there's a few ways that you can obtain additional coverage. The first is you can purchase a Medicare supplemental plan, oftentimes referred to as a Medigap policy, potato, potato. You can purchase a Medicare Advantage plan. You can purchase coverage or you can earn the coverage through a retiree plan. Anyone in here, retiree, General Motors, Chrysler, hourly, salary? All right, so you have an option, obviously, to purchase your own coverage. Veterans, right? If you've earned the right by serving, thank you, the VA will help provide you additional coverage as well. So there's your 4 ways. If you're not part of the VA, you're not part of a retirement plan, you're really left with 2 options. You're either going to purchase a Medicare supplement or a Medicare Advantage plan. There's only 2 choices. So let's understand the pros and cons to both. if you choose to purchase a Medicare supplemental plan. The pros: you can go to any doctor, any hospital, anywhere across the nation, and as long as they accept your Medicare red, white, and blue card, they'll accept whatever carrier you choose to have. Secondly, you're covered at or near 100%. So excluding dental, vision, hearing, and prescriptions, anything medically necessary, by you purchasing the supplemental coverage, you would be covered anywhere you wish to go with no referral requirements at or near 100%. Now let's talk about the negatives. You're prepaying to have this level of set it and forget it style of insurance. You're paying a private insurance carrier $130 a month, $140 depending on the county, depending on the state, depending on the age. You're paying a private insurance carrier a sum of money to know I never need to ask permission, I never have a referral, I can go anywhere I wish, and I know exactly how my insurance is going to operate. Secondly, another negative to a supplemental plan is that your Part D, D's for drugs, I'll take you there in a minute, your prescription drug plan would be a separate entity. So for instance, you'd have your health through carrier A, and oftentimes your prescription drug plan through carrier B, or your health through carrier C and your prescription drug plan through carrier A. Generally, they're not necessarily the same provider, but it would be a separate card. So if you choose, or if you have a supplemental plan and you have questions, there's an easy way to figure it out. You would be carrying 3 cards. You'd be carrying your Medicare red, white, and blue card. You'd be carrying your private insurance, carrier A's health insurance card, and you'd be carrying a prescription drug card through carrier B. Make sense so far? Your second option is to purchase a Medicare Advantage plan. With a Medicare Advantage plan, what you're doing is you're assigning your Medicare A and B to a private insurance carrier. And in turn, the government is no longer dealing with your claims, your billing, or anything having to do with your Medicare health insurance. It's all assigned to this private carrier. So now the government has free time and free money, if you will, to be able to pay this private insurance carrier a sum of money to provide you coverage that's either as good as or better than your original Medicare A and B. So the pros, positives of an Advantage plan. There are many in this area that have no monthly premium or a very low monthly cost because they're subsidized by the government. Another positive is that they generally do include the luxuries of Medicare. Your dental, vision, hearing, gym memberships, prescription drugs would all be included on one card. The negatives, however, they do include prescription drugs. So instead of looking at just a monthly premium, it's really important to add up your known costs, your prescription drug costs and co-payments. Understand that we're going to add, and I'll take you there once again in a second with your prescription drugs, we're going to add up the 3 components and not just necessarily focus on this zero premium plan because they may be charging you $500 a month for your medications, and it may be far less expensive to spend $10 a month for a $10 copayment on your medications. So it's crucial to add up that total cost. Now, with all Advantage plans, they're HMOs or PPO networks. They're just like health insurance, where you're going to be bound to this carrier's network. You're going to need referrals, possibly if it's an HMO, or you may not have coverage if you leave the network, or you'll be penalized for leaving the network because obviously there's no coverage in that area. There's deductibles, there's co-payments, and there's out-of-pocket costs. So with an Advantage plan, what they do is they remove this 20% of what no one knows, and they give you a fixed copayment, where, for instance, it costs you $20 at the primary care or $50 at a specialist. You know how much your durable medical equipment would cost. You would know how much certain items are, but more importantly, they would cap you off at $6,700. So instead of not having any risk or limit to your risk, they at least limit it to $6,700 to know in a worst case scenario by choosing an Advantage plan, I know what responsibility is going to be. Now, 2 caveats. First, no Advantage plan covers observation care. So if you're not admitted into the hospital and you're just being observed, maybe 24 hours, 48 hours, There are additional coverages or plans that you may want to consider to purchase. They're called hospital indemnity plans to cover your observation care in the event you're hospitalized. Your excess charges are also not covered. What I mean by that is the federal government will, let's say a back surgery. The government will deem that a back surgery should only cost $70,000. And if you chose to see a surgeon that charges more than $70,000, you're responsible for a portion of that cost. But more importantly, you probably won't ever see that surgeon because they may be out of network or you may have an additional cost. So keep that in mind as we're understanding these two different styles of insurance. Once you decide on which style of insurance works out best for you, the rest of it's simple. It comes down to either your monthly premium, because all of these Medicare, Medigap plans or supplemental plans are standardized. They're given a letter of the alphabet to alleviate confusion to you as a consumer. A Plan F is a Plan F, a Plan G is a Plan G. It doesn't matter the carrier you go with, the coverage is exactly the same and offered wherever your Medicare is accepted. What you're after is the monthly premium and the ratings of the insurance provider. What's their track record with rate increases, etc. With a Medicare Advantage plan, it comes down to your prescription drug costs, which I'll go into now, as well as going into your network of specialists, doctors, and making sure that you're not going to have a surprise when you enter the doctor's office or specialist's office. Okay, 2 choices, and only 2. Once you make your decision on what style of insurance you're after, everything else is simple. So on the Medicare supplemental side, go to seniorenrollmentsolutions.com. We provide you all of the top 5 carrier rates. You can shop your plan, you can compare your plan, any states on here, just enter your zip code and your age and you're off and running. Nope. On the Medicare supplemental difference, it's on your health because they don't cover medications. Advantage plans, yes, medications are included. So your Part C. Your Part C, once again, it has to cover all of your original Medicare offers, right? It has to be as good as or better than that 80-20 with per occurrence deductibles, etc. Pre-approved private companies, once again, offer your Part A and B, and usually your Part D at the same time. You have one insurance card, as I mentioned, and you can shop your plan from October 15th until December 7th. There's a reason why we're here today. Your annual enrollment period is upon us. You can begin to shop now. You can go on Medicare's website. You can provide us your medications. We'll run them for you. I'll teach you how to do this. I'll do this with you. But I beg of you, shop your prescription drug plan or your Advantage plan on an annual basis, and I'll get into why in a second. So this is why you're seeing the TV commercials. The 3-minute and 45-second Humana commercial, have you guys seen that one yet?
How about the half-an-hour one?
Holy cow, you guys. They're all trying to sell you they're out to make money, right? We're talking about corporate America that doesn't necessarily care about you per se, right? You're a number and a dollar sign to them. That's why we buffer between the carrier and the consumer, because otherwise you're going to be sold. You call Humana, what do you think you're going to buy? You call United Health, what do you think they're going to sell you, right? That's the problem with Medicare, is the way that it's set up and structured. Let's go into your Part D. As I mentioned, with prescription drug coverage, you're either going to have a separate prescription drug plan and a supplemental plan, or it's going to be all in one with a Medicare Advantage plan. This is the time of year, I beg of you, reach out to your neighbors, your friends, have them go to the source, to Medicare's website, have them phone a fiduciary that offers every carrier. Don't just pick up the phone to HAP or Humana or whomever it may, right? Because you understand what you're going to be buying at that time. Your prescription drug plan. The U.S. government mandates that Medicare recipients have a prescription drug plan. You have to have one or you will be assessed a penalty that will stay with you for the rest of your life. I'll explain that penalty at some point in time. You can purchase a plan from, once again, either joining an Advantage plan and having it built all in one, or you can purchase a separate plan, a Part D. D is for drugs, right? There's your Part D of Medicare. Once again, if there's a late enrollment penalty, if you don't purchase it when you're first eligible to have your prescription drug plan, at that point in time, you would have this penalty assessed. Your prescription drug plan is basically like a take a penny, leave a penny tray. And the government assumes that anyone over 65 is going to be putting a penny in this tray. And you may have felt that you didn't need any prescriptions, so you just walked right by that tray, while others need many pennies to help them cover the cost of their medications. If you don't contribute to this tray, they can only assume that down the road, you're going to become ill or need medications, and you're going to want to reach your hand in this tray, and it's not fair to everyone else who's contributed along the way. So here's what your penalty is. It's 1% of the national average prescription drug cost. Currently $33.10. 1% of that is 33 cents. So let's do some simple math. For every year you go without a prescription drug plan, you're going to be assessed a $4.80-ish penalty. $4.80 a month, every month, is about $50 a year. So to break this down, your penalty is about $50 a year for every year you choose not to go with a prescription drug plan. First year's 50,
That's just Part D.
just your Part D. So first year's 50, second year's 100, third year's 150, fourth year's 200, right? So eventually this penalty can get incredibly large. There are prescription drug plans as little as $14 a month that would at least put a Band-Aid and stop the bleeding of the penalty that we know is going to be coming down the road. Not telling you to or not to purchase anything, just understand it so you're not shocked down the road if and when you do need a medication.
My question is, when does the penalty go away?
Never.
See, that's
Never.
not into it.
So you purchase a prescription drug plan and the penalty is still there, rolling along. So you take this $14 prescription drug plan and then you add $45 on it, and now you're up to $60 a month, right? As I mentioned, some of these plans there's like 5 plans under $20 or under $22 this year. It's the penalty down the road. It's on page 79 of your Medicare and U book, which I know we all read through this year, okay? It's on page 79. I'm not asking you to read your Medicare and U book, but you need to understand, if I do this, what are the consequences, right? Once again, I'm not stating to purchase or not to purchase. I'm just letting you know the facts today, okay? Okay. I beg of you, once again, October 15th to December 7th, I want to burn that date in your mind. It's so, so important just to reshop and be proactive when it comes to your prescription drug coverage. So what are we doing to shop this? You're going to be adding up the monthly premium. Currently, right now, in this area, there's 36 different prescription drug plans, I believe, for 2020. 36 of them. They all have a different premium. We're also going to be adding up any drug deductible, your initial cost in purchasing your prescription drugs. Some plans have no deductible. Some plans have an annual deductible this upcoming year of $435. Then you also will have yet an additional cost. When you go into the pharmacy and you purchase your medications, they're going to want a credit card payment or a check, some kind of co-payment, right? An agreed upon a cost between you and your insurance carrier, and that co-payment is going to be responsible at Kroger or wherever you purchase your medications once again. So every year, your premium, deductible, and co-payments will change. Let's go back to insurance being this corporate monster for a second. We all get it, right? Okay. They're going to negotiate out the cost of a medication with that pharmaceutical company. One year, it may appear that they love Lipitor, and your copayment may only be $5. But the next year, when their negotiation isn't so strong on Lipitor, you understand they're passing that down to you as a consumer, and maybe your copayment jumps from $5 to $50. Well, that's an extra $500 a year because you weren't proactive in understanding, if I keep this card in my pocket next year, do I know exactly what my costs are going to be and how my insurance operates? If you're not proactive, I assure you, you'll be reactive. And the next time you purchase any medications or go into CVS, Walgreens, wherever you're going, hang out by the pharmacy in January when everyone's like, oh my God, I can't believe this. And then they throw their arms up in the air and say, oh, this is so confusing, I'll never get this. Just be proactive. Medicare set up a great site for you. I would run your medications, Allie would, any of our staff would, or teach you how to do this. If you want it mailed out or emailed, I'd be happy to provide it. All I'm stating is I beg of you to run your medications because this is the most confusing and costly part to a lot of individuals' Medicare. Every prescription drug plan sets their own price. Companies obviously may require prior authorization, a letter from your doctor as to why you're using Lipitor instead of atorvastatin or whatever it may be. Limit quantities and require a step therapy. So there's other things to consider and look at as you're purchasing your drug coverage. Do we all understand the prescription drug side?
In other words, are you saying you got to review it every year?
Every year. Every year.
Easy to, it's...
Take you less than 3 minutes. Yeah, super easy. I mean, obviously, if you're on 27 medications, it may take 8 minutes. But this will cost you or save you thousands, if not tens of thousands, and for some of my cancer patients, hundreds of thousands a year. You become fearful or stagnant, I assure you, you're going to be paying out more because you don't know what you don't know, right? It just is what it is.
So how do we find out what our medications cost? On your website?
You can go right through our FAQ page, our frequently asked questions. Basically, all we're doing is sending you right where you need to go in Medicare's website. We're not going to a carrier, we're going to the source. And the source then will list every carrier, all of their premiums, all of their deductibles, and what your specific medication costs will be. Then we're just needing to add up the 3 components to come up with this nut of a number of what you're going to be responsible for in 2020, 2021, 2022, et cetera, et cetera. Make sense? Okay. So Medicare's website has all of that. So let's talk about a few things. If you need extra help, if you can't afford your prescription drug coverage, there are a slew of resources out there. You just need to ask and pry. What do I qualify for? What kind of help can you find me? As a single, for instance, if your income is less than $18,735, or if you're married and it's less than $25,000, Social Security has a plan that will help you pay for your Part B of Medicare, that will give you fixed copayments on your medications, remove that dreaded donut hole, and really help make sure that this is affordable for you. The program helps pay for your Medicare plans. Once again, no coverage gap, no late enrollment penalty, it's waived. Pays a portion or all of your Part B premium, provides fixed copayments, and can switch plans. It's not once a month anymore for those on Medicaid or those through extra help with Social Security. It's now once a quarter. They do this for a reason. If you're on a carrier's plan and your Lipitor is no longer covered on that plan, they need to provide you an out so you're not paying full retail cost. So if you do qualify for extra help, if you are on Medicaid, you can move plans once within a quarter, so up to 4 times a year, to make sure that you have adequate dental, adequate hearing, adequate transportation if needed, but more importantly, that your prescription drugs are still affordable for you. You can apply for extra help visiting Social Security. Let's go to the source, right? If you need an application, I'll email you one or mail you one. But Social Security, you can go right on their website. You can phone their 1-800 number, or you can stop into the Social Security office. What you're asking for is Insurance Assistance Program, or SHIP, is really what you're looking for. How do I qualify? Once again, our state has a slew of options and programs to be able to assist consumers that, once again, cannot afford. If you can't afford, reach out to someone. Make a phone call to Social Security. Call Medicare. Call us, right? You don't know what you don't know, once again, and there's a ton of locations that are able to help you if you are unable to afford your medications. Online, you have any questions about your Medicare? All things Medicare related, seniorenrollmentsolutions.com. You can always phone us, 877-777-5972. You can email our customer service. Ellie and I have personal emails. I'm John at Senior Enrollment Solutions. She's Ellie at Senior Enrollment Solutions. We have a slew of YouTube videos. I've done a lot of videos on Medicare. This presentation is on YouTube under the Senior Enrollment Solutions channel. you have any questions or just want to go back and review a minute, minute and a half long, this is why we film. I'm not here trying to sell you something. I'm here trying to get you empowered and educated so you help your friends and family, because this is confusing and costly, and we have to, as a society, take control over this. The only way we're going to do so is not be sold something on a television commercial, but be knowledgeable and empowered so we can save our own money as we go through retirement and start planning for inflation. The Medicare website, right? Medicare.gov. Obviously the source. You're more than welcome to visit the Medicare website. Any other questions, concerns, like I said, I'll provide my business card to anyone that wants. We get our A, inpatient hospital room, per occurrence deductible, 80/20 thereafter. We have our B, right? Everything else excluding dental, vision, hearing, and prescription drugs. You have your C, either a Medicare supplement, Medigap policy, same thing. Standardized, right? Given a letter of the alphabet to alleviate confusion. Coverage is exactly the same. Or a Medicare Advantage plan. Once you understand what you have, then you can start utilizing all the benefits out of that coverage, or at least alleviate the surprises that may come down the road. I don't like surprises, and nor do you. So knowing your coverage, your A, your B, your C, and your D, why do I have this? What am I paying for? And what value do I have out of my insurance?
Are you going to get into more of the Advantage plans, or is the main difference that you can get a lot of surprise billing with Advantage plans? They make it sound so good.
I could sell you a rose, but you know there's thorns attached.
Yeah.
Really? Right? So let's talk about that. Gym memberships, right? Silver sneakers is included. Transportation, over-the-counter medications, dental, vision, hearing. We'll go into the dental here in a second. They front load these policies. So let's talk about who typically has an Advantage plan and who typically has a Medicare supplemental plan. 9 out of 10 consumers in the state of Michigan, 88.9% of you have a Medigap subsidy or supplemental plan. The other 10% typically have someone helping them with the $6,700 potential risk. So let's do a little simple math. You're on an Advantage plan and you don't have anyone helping you cover this risk. In December, you have a heart attack, you're admitted. In January, you need a stent. In January, you're going through physical therapy. It starts over. You could potentially spend $6,700 this year and $6,700 next year. So, how many months or how many years do you not need to use your insurance? If you're paying $130 a month, can you guarantee me that you're not going to be admitted in the next 7.5 years? No. So you're running this, they're going to get you coming or they're going to get you going. It's a fact of life, right? Okay. Typically, those on Medicare Advantage plans have Medicaid. The state has come in to take care of their health insurance, but they're lacking dental, they're lacking vision, they're lacking transportation, they're lacking incontinence materials over the, right? You're only making $650 a month. There's a cost here that we have to make sure not just your health insurance is taken care of, but everything else you may need to remain healthy is taken care of. So SHIP, LIS, or someone in the VA. I have veterans coverage. I love going to the University of Michigan, which is part of the VA there, right? Wonderful facility. Can I just get some dental? Because the VA doesn't offer dental. So sure, you can find a zero premiums Advantage plan that offers dental. Now keep in mind, there's 2 terms, exclusions and limitations, okay? And they're in every insurance packet, You have to understand that when a carrier offers $3,000 worth of dental work, including dentures, bridges, crowns, there's got to be a catch somewhere. That it's not on the back 3 teeth and that they don't span between a tooth that's been pulled or extracted, right? So there's your rose, $3,000 of dental. There's some thorns that it may not actually be the dental that you require or need. So front-loaded policies, for those that are taking on this risk, be very well aware of the risk that you're taking on. You may not have a monthly premium, but you better be setting some kind of funds aside, knowing that this day is going to come where I'm actually going to need to use my insurance. That's why you have it. And at that point in time, don't be surprised when you have co-payments, deductibles, and out-of-pocket costs. Does that make sense? Because, I mean, Wikipedia says 88.9%. That's what I'm going off of, as well as what the carriers go off of. Obviously, I've been doing this a long time, and I know what my consumer base is on those that would prefer just to pay a monthly premium and those that do need extra help. There's a lot of individuals that have been disabled, no choice of their own. They fell off a roof, 1976, broke their back, and it is what it is. So there's that's why you have two very separate animals when it comes to insurance. You will never, ever see a Medicare supplement commercial on TV. Ever. They're not standardized by the government. They're not regulated by the government. You'll only see Medicare Advantage plans, and you'll see every one of them in the next 72 days. So thank you all once again for attending. This is the most important thing. As long as you know why I have, what am I paying for, and the value I have out of my insurance, we could all overly insure ourselves. $7 a month on a cell phone, $14 on a microwave, $22 on a refrigerator. I mean, there's too much insurance sometimes, and just be aware, especially as we all continue to age, what our bills are and what the value is out of our insurance. Go ahead.
On that $6,700 on the Advantage plan,
Correct.
does that cover any of the, what you would have to put out on the drug side under that?
No. And that's in network. You leave the network, there's no coverage, or you would be penalized, and there wouldn't be a maximum out of pocket if you left the network.
So the drug plan would be similar as if you went with a Plan D?
It is. It's just built into the health. It's actually a separate entity. So sometimes, for instance, a Medicare Advantage plan may cost $18, but 4 of it is for the prescription drugs. 14 of it is for the health plan itself.
You keep talking about on the new Advantage plan, there's supposed to be coverage for hearing and vision. So how does that work?
They front load the policy. On a Medicare Supplemental plan, if you wish to purchase dental, you're purchasing a separate plan, right? You're going to go purchase Delta Dental, MetLife, Carrington, Dentamax, somebody to have dental coverage. Same with vision, right? If you need help thinking outside the box on your dental, your vision, your hearing, your prescription drugs, SES does provide a free prescription drug card. It's set up at every pharmacy across the nation. You can always go in, especially since you don't have prescription drug coverage, what's least expensive? Your cost, or can I use this card and save some money? There's no cost for these cards. There's a stack of them up here. We just try to help you think outside the box so you're never paying full retail cost because your glasses fell off the boat or whatever may have occurred within your life, okay?
If you have a drug D card that you use
Yes.
and you wanted to try to see the discount on that,
Yes.
you just go and tell them that you want to do it with
Yeah, hey, I have 2 cards, right? You have my Carrier A card on file. Will you compare that to this? Now, this is not to interrupt your prescription drug plan. However, you may be in the donut hole. Some of these medications are so expensive that this dreaded donut hole starts over every year. So some consumers are in the donut hole right now, and they'll never get out of the donut hole. They're just responsible for 45% of their costs of their meds. This may be a great avenue to get them a lower cost, knowing that in January, we're going to reshop our coverage this annual enrollment period, October 15th to December 7th, and then we're going to see where this donut hole is next year. But this is to help them get through the donut hole. May 2014, a carrier decided to quit covering Lipitor. And this one conglomerate carrier must have millions of consumers on their plan. And they were outraged. Many consumers were on that specific drug. And unfortunately, the generic had some side effects, leg cramps, whatever, right? To each their own. They can't switch plans because they're not annual enrollment period. So what do? Are you paying full retail costs for this medication? It's just a backup plan. That's all we're trying to provide you. Let me help lift up some stones and help you look outside of the retail box. There are ways of saving money. Buying your eyewear online. And there's so many websites out there and ways to be able to help you not necessarily pay full retail price. Similar with dental. There's dental plans that have no waiting period, that have no cap. I'm not saying to buy one now, but you need a crown, you max your insurance or it doesn't cover you, know that we can get you into the dentist office tomorrow. Today, frankly, 'cause today's still young. So there's just ways to help you think outside the box so that way there's never a surprise and you're never paying full retail cost. So please visit our website. Let us know if you need anything mailed, anything emailed, right? Or just stop in our office. We're right at the corner of Clintonville and Walton. Ellie's there all the time. I'm there most of the time. Would love to just answer questions for you and empower you to make the right decisions as opposed to being told, go into a Walmart during annual enrollment period. Someone's going to be selling you a plan. Go into CVS during your annual enrollment period. Someone's going to be trying to sell you a plan. Don't be sold. Be empowered, be educated, make the right decision, and then go help others make the right decision too. So if you need instructions, if you need links, if you need whatever you need, we're always going to start at the source, and then we'll work down to the carriers. Make sense? Okay. Thank you all again for coming out.